This is a scientific vetted report from the Harvard University Medical School. It's titled Anti-Racist Epidemiology. Research suggests reparations for slavery could have reduced COVID-19 infections and death in the United States. This was published online on February 9th. What it does is it is to estimate the impact of structural inequities between black and white individuals. The researchers set out to capture the effect of reparation payments on black-white wealth gap, my friend, in the state of Louisiana. This is an important report. The disproportionate effects of COVID-19 on racial minorities, black individuals in particular, have been well documented. Black people get COVID-19 at a rate nearly 1.5 times higher than that of white people, are hospitalized at a rate nearly 4 times higher, and are 3 times as likely to die from the disease as it first started, according to the latest estimates from the U.S. Centers for Disease Control. And so the greatest disease burden among black people have caused tremendous loss of life and unspeakable suffering across these already vulnerable and disadvantaged communities. Notably, these effects have also spilled over and are driving transmission rates of virus in overall population. And so they did their study in many places, but I'll read a portion of the study. Examined the initial period of the outbreak before the infection control measures were implemented. So many differences in infection rates between populations at the time would have been driven mainly by differences in the social structures. Very quickly, Louisiana has a population heavily segregated by race, with black people having higher levels of overcrowded housing and working on jobs that are more likely to expose them. And they found that if reparations had been given, they would have done better. I conclude, Mr. Speaker.
Ladies' time.